Back everyone, we're live on Facebook, so hi to everybody out there. I'm excited about bringing on my next guest. She's been on with me a few times before. I have with me Dr. Katie Baljamin, and she's the owner of Personal Wellness Physical Therapy. Welcome back to the show.
Thanks for having me.
You gotta tell everybody a little bit about what you do, because you do a lot.
I do a lot. So I am a physical therapist, but I specialize in pelvic floor dysfunction. So I treat women and men who have bathroom issues, basically. Going to the bathroom all
Who
the
doesn't
time.
have bathroom, issues?
It's very common, but it's not normal. But men, women, going to the bathroom all the time, urgency, leaking, constipation, abdominal pain, postpartum rehab, pelvic pain, things like that. So that's one thing that I treat. The other thing that I treat is lymphatics. So people have chronic swelling, lymphedema, lipedema, which we'll talk a little bit about today too.
I can't wait to talk about that because you're going to be doing a giveaway.
Yeah.
And we're going to open up the lines to the audience for everyone to get a 1 hour, they're going to get entered in to win a 1 hour visit. That's a lymphatic drainage. And you're also going to be able to use the Med Wave Light. And I want you to talk to them a little bit about it, because it is really, really cool. So go ahead.
Okay, so for anyone who is not familiar with red light therapy, turns out our skin has natural physiologic responses to light. When we go outside, UV light from the sun stimulates us to make vitamin D. When we look at blue light from ideally the sun, but also our phones, it actually stimulates our brain to be awake. That's why we shouldn't use our phones before bed.
That's the problem.
That's the thing. But red wavelengths of light has a lot of really cool effects it has in the body. It actually will stimulate collagen production. It stimulates cellular metabolism, so it actually boosts energy. It will stimulate cellular regeneration and healing, which is where a lot of times people use it a lot for their face to help with fine lines and wrinkles and all the nice pretty things. There's some research that shows that the red light will decrease your cortisol levels, which is your stress hormone, and will increase your dopamine levels, which is your feel-good neurotransmitter. So it actually can just really help boost your mood. It boosts just well-being.
So the minute you walk in, if you get this, you're going to feel good no
Feel
matter what.
happy, yes.
Happy.
So we use the red light, but I also use near-infrared light. So the near-infrared light is big for pain and inflammation. So that one gets a little bit deeper into the body and can really help with, we're boosting that healing process, we're reducing pain, we're getting people moving a little bit more. So that's your typical standard red light therapy you're gonna find. You can find panels online, you can go to wellness clinics, they have them. Mine's a little bit different. So mine has a special lens over the bulb, so it actually focuses the light beam more. So normal light scatters, covers the whole room, right? So with mine, what it does is it focuses that beam, just like if you take a magnifying glass and you go outside in the sunlight and you're like focusing the beam to burn a hole in a piece of paper, it does something similar to that. It's gonna let that light penetrate up to 4 times deeper into your body.
Wow.
I actually originally got this light so that I could treat things like endometriosis, really deep structures, whereas your typical red light panel is just getting about 1/2 inch into your skin. Mine's gonna go 4 inches. Way more depth of penetration, a ton more effects, like crazy things that I've been seeing with it. I'm
Yeah,
so
you
excited.
have been so excited about it. Now, our lines are open here for everyone to get entered in to win this 1 hour. It's a visit that you're going to get. It's $140 value, free to you or anyone you know. I want to first talk also a little bit about lymphatic drainage, right?
Yep.
And why people should do that.
So it's a really good wellness tool in general, but really because I'm a clinician, I'm a physical therapist, I treat disease and dysfunction. The things that I use that the most with are lymphedema, which is chronic swelling due to damage to the lymphatics. That can happen after cancer treatments because lymphatics were removed. It can happen with chronic swelling like leaky veins. Eventually that swelling just doesn't really go away. Sometimes even like severe trauma or surgery can cause that problem, and we just get swelling that does not go away. That is one way we would use the lymphatic drainage. The other is with something called lipedema. Lipedema is a different condition entirely. It's similar where we get, it's almost exclusively women, where you get an abnormal deposit of abnormal fat cells into the hips, the butt, the thighs, the calves, sometimes the upper arms.
Yeah, we know those.
Once you know what you're looking for, you kind of see it everywhere. But it's very inflamed fat cells, so they hold on to more water. So we get a lot of this heaviness. It's painful. Varicose veins, vascular problems happen about half the time with these people, and it's a very painful condition. And so we use the lymphatic drainage to help move some of that fluid out and help make them more comfortable. But then my job is also to help direct them towards other self-care ways to manage this moving forward, like compression, pneumatic compression pumps, things like that. So the light is a really, really helpful tool because it's reducing a lot of this inflammation. It's stimulating the lymphatic system to move, so we get a lot of that out, and my patients just feel better.
That's so
Because
awesome.
nothing else helps them really feel better.
And it's non-invasive, it's not
No.
even, it's nothing, it's very, very, well, I wanna ask you though, is it FDA approved and all of that? Or does it even have to be? I don't know.
No, I mean, like, this is stuff you can buy on Amazon. You can buy any light panel on Amazon.
Right, I've
Mine is-
seen it, I've
yeah,
seen it.
and those are great. It's all
But
about
this
how
is
close they are.
different,
This
because-
is more powerful.
Right, more powerful.
We're not into, like, class 4. It's not a laser. Like, there are lasers that you have to be a clinician to use because you could burn people. This is overall very safe to use. It's just, big panel. It's pricey. It's not everyone's just gonna have one of those at home.
So again, we've got our lines open here, and we'll let everyone call throughout the rest of the show. Our number here is 602-277-5369, and toll free it's 1-866-536-1100. She's located in Ahwatukee at Elliott and the I-10. Her website is Personal Wellness PT. So personalwellnesspt.com. Her phone number, it's 480-485-6574. Call in here. This is something, when you're talking about inflammation, and most of us are inflamed like crazy, right?
All the time.
All the time. This is gonna be something that's gonna be healthy all the way around. They
Okay.
don't have to have like you mentioned, you've a lot of people that had cancer, but there's always good reason to get rid of that inflammation.
It's wellness. We need to. We have a sick care industry that we live in, and they're not really there to keep people well. We want to do as much preventative as we can, because this inflammation feeds into horrible things like cancer and autoimmunity and just pain, inflammation, arthritis. Those are all things that inflammation we always have just feeds into it.
So call in here and get entered in to win. Our number here is 602-277-5369, and toll free is 1-866-536-1100. Let's talk about what a treatment looks like. We went through all of that pretty fast.
I know,
It was
right?
crazy. So go ahead.
Okay, so when we are treating with the light, the first thing that I have patients do is go on my vibration plate. Vibration plates are awesome. It's just going to help stimulate the lymphatics too.
Very good for you.
And it's really, actually, it's kind of nice too, because I'll have people kind of exercise a little bit on it. You can get like a 30-minute workout into a 10-minute session on the vibration plate, which is pretty cool. But what we're doing is we're creating an energy demand. Your body now it's working out, we're getting everything going. Your body wants energy. So then we do the lymphatics, we get the lymphatics moving, and we use the light. One of the other things that this red light will do is it opens up your fat cells. The actual, just your normal fat cells, and it releases the stored energy in your fat cells back into your bloodstream. So now we have an energy supply. So we've done this session, we're doing all these really wonderful feel-good regeneration, which also requires energy, but we've got all these fat cells that are now opened up. And then we do the lymphatic drainage, which also feels wonderful. We're all done with the light and the lymphatics. We go back onto the vibration plate at the end.
To move it around?
Well, so we've got this energy demand again. So now your body is now working out even more. We had all this new energy that's been released into your body from these fat cells that are now gone because they've been released. Now your body's using that energy. So those fat cells, they go away and they stay away. It's natural weight loss.
So really?
Kind of, yeah.
Okay,
I
so
know,
that's
right?
kind of cool.
What's
Now,
up?
natural weight loss, wouldn't that be wonderful? Right now, if everybody would stop taking those shots and doing all the things that they're doing and listen to what we're talking about here.
It's just another tool in the tool belt. So
Where does it go? It goes out the pee-pee?
Basically, yes. So
Yeah.
it's energy, right? So when you're removing fluid, yes, you're gonna urinate out fluid because that's the only way it's coming out. But burning energy is burning energy. It doesn't go anywhere. You're exercising, right? You're just creating that demand.
How much do you see that people lose weight?
So I track a little bit with weight because a lot of my patients, they're trying to lose weight regardless, especially
Right,
with something like
everybody is.
lipedema. So
Mhm.
that's not my main metric. We will take size measurements, and then I will gauge too as I'm getting someone compression garments. The goal is that their size, their swelling is going down.
Can you imagine feeling better naturally, losing weight naturally, and again, feeling better
Yeah.
naturally?
Well, so really quick, and I have this patient, so I've been seeing her for about 4 years with lymphedema, cancer related. She's very stable, she's not changed at all. The first time I used my light with her, she lost 1.5 pounds of fluid from her leg.
Ooh, wow.
A whole pound and it stayed off for at least 2 weeks. The hardness that happens in her ankle and heel got softer. As we keep doing this, we've done like 4 sessions with it. She's had a significant change, an inch around in her calf is
Oh
gone.
my goodness, that's awesome.
I know.
Everybody's getting entered in to win. It's a 1-hour visit. visit that is gonna have your emphatic drainage, that you're gonna get that, and the MedWave light, that she's also gonna work with you on that, and it's $140 value, free to you, or you're listening and you think somebody else might want it, give it to them. Our number here is 602-277-5369, toll free it's 1-866-536-1100. It's personal wellness pt.com. Check her out on her website. You can call her direct. Her phone number is 480-485-6574, or call in here, get entered into win. This is awesome. Again, our number here is 602-277-5369. Keep on going. That's awesome. I know, that was, you were on fire.
I talk really fast.
I know you do. And let's see, where else are we here now? We're over here, and we are on the treatment, that's what we talked about.
So anyone who shouldn't be doing it.
Okay, are there?
Yeah, so like with anything, like we generally are like, not over pregnant babies or pregnant uteruses, active cancer. There are some medications.
Pacemakers okay?
Pacemaker's fine with the light.
Okay.
Yep. And then, so like some medications cause what's called phototoxicity. So it's one that's more of a precaution than anything, because UV light is actually worse than the red wave light, because everyone always asks me if they're gonna get a tan in there, because it's very warm, and it's very comfortable. It's very comfortable warm. Most people are you kind of get off just feeling good, because the dopamine side of things, like they just feel good.
Yeah.
But no, so there's no tanning, there's no radiation.
No,
anything
it's
like
not
that.
about that.
Right, and because that's not what it's doing.
But I think I would like you to reiterate when we come back the difference between yours, because you can go to other places
Sure,
and they have
and
all
they're-
sorts of stuff.
Right, and so the part of it
Totally
too is like, and
This is medical grade.
It's medical grade, and because people will get them at home, and it's like, that's fine, like use it at home, because you can use it more, because mine you can only use 3 times a week max. 'Cause
Okay.
you get into you get like detox effects from it. So the lens is really the big one that allows that penetration, and that's why it's so much different, because I've never heard of anyone else getting a inch size
4
reduction. Like,
Yeah.
4-inch depth, and because I got it for endometriosis, I can talk a little bit about that too.
Yeah.
I use it the most with my lymphatic patients, though. They just get such awesome results. It's
That's
super
amazing.
cool.
Because I never heard of a lymphatic patient.
Yeah, most people don't know it until they know it. Like cancer is one of the big ones where they'll get it because the lymph nodes get removed, but like obesity causes it.
Is it from diabetes?
Not necessarily, but all of the things that come with diabetes. So
Yeah,
if you're
because
overweight,
all
you're
of
not
them.
moving.
They're good patients, right?
No? Yeah, no, they're good for this. And like the light, same thing, it helps with regeneration and healing. So like wounds, it can help with healing wounds a bit.
I
It's
think we
increasing
talked about that
circulation.
one.
Well, and that was with the Sofwave too, because the Sofwave is FDA cleared to treat the
Right.
diabetic wounds.
Okay.
Which is kind of, I put in there too, like these two things go so well together.
Yeah, that's what you were saying.
For like endo especially, like it goes great for endo.
And I have a niece that has that, and I'm gonna have, because I think she had surgery.
Yeah, they do that. And like it's a Band-Aid because it comes back.
Well, we'll talk about that.
We can talk about that.
Mm-hmm.
Because like, and the other big one too is like, I want to start doing memberships where it's like can come in and just use the light, because it's relatively self-service, but it's so much more
You have
effective.
that here?
I will soon. So I got in like for packages and costs.
Okay. I'll let you handle that.
Yeah.
Okay.
Well.
Here we
yeah,
go. So welcome back, everyone. The doctor's in, and we're talking right now, and we're talking a little bit about lymphatic drainage and why that's so important. And I think what's wonderful with you is that first of all, you're incredibly passionate about what you do, and you like to try and find different ways of doing things on a natural basis, right?
Yeah.
And right now we've been talking about what all this is and what the difference between her light wave, her red light, I should say, red light, is compared to all the rest. This is what I want you to hear, folks, because hers is medical grade. Go ahead.
It is. It's this light, this lens that's over these light bulbs. So it's that depth of penetration, which is the big difference. So when you're dealing with red light, there's a couple things that you keep in mind. There's the actual power. So we can have wattage of the bulbs and how strong they are that way. You can get a huge range, even from like small rinky-dink ones you'll find on Amazon. You can find some that are like, oh, it's 3,000
Cheap and
watts.
cheerful ones.
Right, but so that's one component. The irradiance is another, how much of that light's really getting to the body from how far away you are to it. So if it's a lower irradiance, you have to really be pretty close to it. So they make some that you buy at home, and they literally sit on your skin. And like my dad has one of these for his knee, and he's like, I don't understand why it's not helping. It's supposed to help. So it's just not really getting deep enough for something that's that deep of a structure. And then there is also the lens itself. So the light, like I said, light scatters. My lens is gonna focus that light. So once it gets stacked one on top of another, that's where we get the depth. So medical laser technology, so low-level laser therapy, you'll see it at chiropractors and physical therapy offices. It's great. Those individual photons of light are one stacked, one right on top of another. So they go really deep, but the treatment area is like this big. So, you know, someone's low
That's
back.
small for us radio folks out
Very,
there,
very
this
small.
big.
Very, very small. It's so, you have to take a long time to get all of the areas you need treated. Versus these light panels are big. My panel is like 3.5 feet long. So we're
Wow.
covering the whole body in a 10-minute visit.
Wow.
So but with a typical light panel, you're covering this broad area, but you're not covering it with enough depth.
Mhm.
So that's the balance. My light is the perfect blend.
I love it. Now, we have our lines open here for everyone to get entered into when it's a 1-hour visit. It's a lymphatic drainage that you're also gonna have this, what they call it, the MedWave light. And so it's $140 value free to you or anyone you know, and our number here is 602-277-5369, and toll free it's 1-866-536-1100. Check her out on her website, personalwellnesspt.com. You're gonna love her. Now, I also wanna talk about what we were talking about before, which is endometriosis.
Yeah.
A lot of people have had that. A lot of people find out after they're trying to get pregnant, it doesn't work, then they say, oh, you know what, you got endometriosis. Some people have had surgery, and what did you say?
It comes back. So endo is hard because it's an inflammatory condition. It's something we're not curing, but a lot of times it just gets, well, take some birth control, take a medication. It's not really gonna fix anything. We're just gonna hide your period instead of really treating the problems. So with endometriosis, this is a big deal. It is not something to just kind of like, oh, whatever. We want to make sure that you're changing your lifestyle for it, because really it can be very debilitating. These women are out of work, they're out of school for days at a time, several times a month even potentially if it's really
Because
bad.
of the pain?
Because of the pain. You just can't get out of bed. So it's important to make sure that you're eating very cleanly with diet. If we reduce inflammation, it's just going to come back if you're not eating well. So there's a lot to go into there. But this light that I use, is specifically why I got it, was to treat the endometriosis, because it goes so much deeper. And so it's gonna help to trigger your body to start healing some of these adhesions and some of this inflammation with the actual red and the infrared wavelengths, and then combining that with that vibration plate, because now we're loosening up the rest of your body, we're getting more circulation into the areas. Again, it's adhesions. That's really what they're doing with the surgery, is removing adhesions.
Right.
But they're just gonna reform because the endometriosis is still there.
So question to ask you, let's say somebody has had surgery a long time ago,
Mm-hmm.
and they didn't realize, they thought it was gone,
Mm-hmm.
right? And now they have some pain, but they don't think that's it because they thought it's gone,
Yeah. no,
right?
no.
So can you help them even no matter
course.
no matter
That's-
how long they might have had it?
That's what's really cool about this, because your body's it's triggering the cellular regeneration. It's the medical director for this company that I got my light through. He's a GYN, and that's what he treats, is fertility and endometriosis. And when he has patients who are really strict about their diet, in addition to using the light up to 2 to 3 times a week for 4 months, and it kind of goes down in frequency from there, but they're actually finding that some of the lesions, the internal lesions, are reducing, and they're able to get pregnant naturally.
That's wonderful.
It's
I know a
amazing.
lot of people have trouble with that. So you can check her out on her website, which is personalwellnesspt.com. Her phone number is 480-485-6574. You do free consultations on the phone.
Over the phone, yeah.
Over the phone. She's located in Ahwatukee on Elliott and the I-10. We've got our lines open here for everyone to get entered into when it's a 1-hour visit. It's a lymphatic drainage that you're gonna get, plus you're gonna get the MedWave light that you're gonna get as well. And it's $140 value free to you or anyone you know. And our number here is 602-277-5369, and toll free it's 1-866-536-1100. 100. Let me ask you, how many people, like, you know, have to come back a lot, or how does that work?
Sure. It depends on what we're doing. So like I said, with the endometriosis, if we were like, someone's really suffering and we want to attack this head on, I have a 4-month program. So we do twice a week for 2 months and then once a week for 2 months, where we're really trying to attack as much of this as humanly possible. That package, it's somewhere in the neighborhood of like $1,250, because that's really just focusing with the light. If I have someone with lymphatics and their lymphedema is a problem, I cannot cure lymphedema. I wish I could. There's some surgeries that are helpful. There's a lot of things that can make this very manageable, but it is not going to go away. It is technically a chronic progressive disease. So maintenance is key. So what maintenance looks like might vary person to person, but if we're starting a little bit behind, we have a lot of fibrosis, hardness in the tissue, we got a lot of swelling to work through, we should probably start a little bit more frequently, 2 to 3 times a week. 3 times a week is the maximum. And then we can go down and work our way towards once a month. It's just maintenance.
But everybody's different.
Everybody's different, and I've had patients who really truly feel better for at least a week without doing anything in between, because we're just starting out. They don't have compression yet, but they still feel better for up to a week or so after using this light. And it's just enhancing all of the other really important manual therapy things that I do. It's not the silver bullet. It's not something where it's like, oh, just do the light on its own and it's gonna cure everything. It enhances me.
Yeah, exactly. I was just going to say, this is a modality that you use several modalities, plus what you already do, I got to say hands-on.
Hands-on. I'm super hands-on.
Yeah.
If I'm not 95% working on people, I don't feel like I'm doing my job.
Right. And so that all of that is what you get with her. And I think that's also what makes you so different. You know, you're not just sitting there going to go in there and say, okay, do this little exercise with this ball. You know, it's way more than that.
Oh, so much more. And I'm so big on education. If you don't understand why you're doing something, why would you do it?
I agree. I absolutely agree. Now, did we get to this one, the MedWave Narrow Light?
So yeah, that's the light, the narrow light.
So we got
that's what
that's
that
the
lens is, the narrowing of the
okay.
light. Yeah.
And we talk about the packages. So how does MedWave complement then the software TRT? Like, I know what TRT is, Doctor.
So the Softwave was, last time I was here, I brought in my Softwave device.
I'm going to remember that.
Of course you're going to remember.
I remember what she brought in. That was pretty cool.
It was cool. And so that video is online too. But so the Softwave, it's a device that actually, local area, but it will trigger your body to heal itself very locally. So it's using shock waves to trick your body, and you're sending your own stem cells to the area and to start this healing process. Now the light is working more globally. We're getting this big broad area, but the same general effects. So especially for like endometriosis, I work right over the pelvis. I even work over, you know, the perineum and this whole area where we're actually getting very, very concentrated healing to that area. And then the light is going to continue diving deeper. It's going to increase circulation everywhere.
I want to quickly do something before you go.
Yeah.
Okay. I know I interrupted you,
That's
but
okay.
that's my show. Okay.
I know, that's a lot.
So I just have to say, we talked a lot about women sort of things, you know, men, but also just pain. Let's talk about pain, because everyone's in pain.
Oh yeah. So I same thing, like I use this to complement for like if I'm working on somebody's knee with a lot of scar tissue or a lot of just like sore stiffness. The vibration plate loosens you up, the light warms you up and gets everything going, and then I can move all of that stuff out of the way. I do dry needling, I do cupping, I do manual therapy. I've got all these other tools in my toolbox so I can work on a lot of that pain. But that's kind of where like I love my network, where I work with sports chiropractors and physical therapists and massage therapists and functional movement and all of these things that complement together, because my specialty really is super narrow and weird. That these more generalized things, I want to make sure if I'm not the right person, I'm going to send you to the person who is.
But do you feel that with pain, because pain is a lot of it's inflammation. So starting with doing with what you do,
and if you're already doing something, someone who's already in physical therapy or already seeing a chiropractor, this is going to make them more effective, especially for something like the Softwave, for like your knee or whatever it is. You're going to get better faster seeing them for all the exercises and their things that they're good at. Mine is just going to make you better faster, and that's what we all need.
And that's what we want. More than anything, that's what we want. We've got our lines open here for everyone to get entered into win. It's a 1-hour visit, and it's an lymphatic drainage is what you're getting with the MedWave light. And our number here is 602-277-5369. Call in whether it's for you or someone that you know. Check her out on her website. It's personalwellnesspt.com.